subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors today. It's a rainy day in many parts of this country, and I hope all of you are safe. We are delighted to have here with us Dr. Avanish Arora, who's a leading urologist and who will speak with us today on urological complications in senior citizens. Let me introduce him and talk a little about him. He is Director Urology and Uro-oncology and Senior Consultant Robotic Urology at the Nanavati Max Hospitals. He is an MBBS from GS Medical College, and that is KEM Hospital in Mumbai, and a Master of Surgery from the Tata Memorial Hospital. He's done his DNBs in general surgery and GenitoUrinary surgery, an MCH, MRCS, fellowship in advanced laparoscopic and robotic urology from the UK. He has undertaken training in laparoscopic and robotic urology, the IUPUI in the US, fellowship in Endourology in Mumbai, and has received the Hargobind Foundation Fellowship, the Birla Smarak Foundation Fellowship, and the Eagle Traveling Fellowship. He has over 26 years of experience in endourology and laparoscopic urology and uro-oncology, and was consultant and head of urology, uro-oncology, and renal transplantation at the SevenHills Hospital from 2010 to 2018. He is been faculty department of urology at the KEM Hospital in Mumbai. He is a member of the Urology Society of India, West Zone Urology Society, the American Urological Association, the General Medical Council UK, and the Royal College of Surgeons, Edinburgh. Welcome to Health Live at Seniors today. How are you, Doctor?
Very well. Thank you for a very generous introduction.
You have done it all, and I think it only I have to do justice for that. We've caught you at the hospital right now. Tell us, Doctor, before we get into the subject matter, how's the scene now as far as COVID is concerned?
COVID has waned quite a bit, so I don't think it is a matter of concern at this point. Though a month back or so, we did feel that we are going to get another wave. But this particular variant of Omicron, which has been prevalent in the last 2 months, has been so mild that it has really not affected life in any way. People are getting it, but the symptoms are so mild that we can just go on with it. Well, with government regulations, patients are getting quarantined. Some patients very rarely are getting admitted, but we're not seeing any complications. So the light at the end of the tunnel, the ray is here, and it is getting bigger and bigger. And I think we are done with it now.
That's very heartening to note. Doctor, I must tell you that in early June, we had Dr. Hemlata Arora here. And she spoke with us about things, and it was essentially on immunization, but we did ask her about the scene of COVID, and it was at that time looking as if it's going to peak and become quite grave. With I had heard stories about COVID wards in hospitals being full in various Mumbai hospitals. In rest of the country also it was increasing, Pune and the rest of the state. So it's heartening to note that things have eased.
Yes, I think we've gotten lucky. That's all I can say. I think most of it, the virus has burned through our population and it's become weak. That's the way it is. So everyone somehow or other has got some immunity. We've all gotten exposed, some more than once, and it has done all the damage it had to, and now we can look forward to life beyond COVID, I would say.
Yeah, let's say fingers crossed. I think we should be able to get away from it. But the fact of the matter is that it is still a scare. For instance, today, if one does, earlier, if you would find somebody sniffing, then you would not bother too much about it, or you would perhaps just distance yourself, and especially people who are traveling in local trains and public transport. But now, if you do see that, then you start worrying. If there's somebody in the office who's coughing, then you raise an alarm. So unfortunately, that is what the scene is.
But invariably, in this season, a lot of influenza and other regular non-COVID respiratory illnesses show up very often. And I think it's time we get over it. Just that patients with quite significant comorbidities, if they get exposed to this variant of COVID-2, they can have some issues. So they should exercise as much caution as they can. And rest of us, I think we should go on with our lives. I mean, we can say that we can say that our race has beaten the virus, and hopefully it doesn't crop another surprise.
That's a very heartening thing to note, because you are at one of the premier hospitals of the city, and you've seen the various waves so far. So you obviously know it better than anybody else. Doctor, we've been running Seniors Today. Seniors Today has been in existence in the last 3 years. In fact, in July 15, we'll be publishing our 3rd anniversary issue. And sometime after we set up Seniors Today in July 2019, a year later, we started the webinars. That is in the middle of the first lockdown, because there were just too many requests and people wanted to consult doctors, etc. And we have now completed 2 years. We completed 2 years in June. And so we've had over 115, 120 webinars. And although we've had urological issues, we've tackled it in the past, but we already see 66 people who are logged in right now. And there are a host of others who watch it on other Facebook or Twitter or YouTube, and of course seeing it later. So over to you. The topic is urological concerns in senior citizens. Those of you who have questions, please put them in the Q&A tab. As always, mention your age and your gender so that doctor would be able to give a considered reply. Doctor, over to you. You have a presentation.
Thank you, Pradyum. Yeah. It's heartening to see that we have such platforms where we can reach out to senior citizens and they can reach out to us and then connect with us if any specific needs are there. And I'm actually delighted, and I feel privileged to be a part of this forum. And I'll quickly go through. Shall we share this? Just share.
Yeah, we can see it well. We can see it.
So I shall quickly go through. I'm not going to talk too much. I will talk about things that actually concern the senior citizens, things that they need to identify, the symptoms primarily, which if they are made aware of, which otherwise would go neglected, can make quite a difference in the quality of life in senior citizens. You already introduced me. We will skip this aspect. So as I said, I will keep things very basic. I'm just trying to use a very few slides to pictorially also point out the main things. So as you know, I'm a urologist. I practice this science which concerns with the kidneys and its drainage system of the urine, which comprises of the ureter. And then the urine getting stored in the bladder. So this is a small diagram if our senior citizens can see. All the blood in the body from the heart needs to get purified after it's been used up by the various organs. So the blood gets transmitted to the kidneys, where it goes through a filtration process. And after the filtration is done, the blood gets returned to the heart and then yet again gets used for the rest of the organs in the body. Now, kidney, after the filtration is done, forms urine, and all the impurities along with urine get thrown out of the body as urine. So from the kidney, structurally, urine comes down these narrow tubes called the ureter to the bladder, which is a storage organ for urine in the lower tummy. And from the bladder, the urine comes out in males through the urethra, which passes through the penis. And in males, where the passage starts from the bladder, there is this walnut-shaped organ called the prostate, which is the Achilles heel in most elderly men and responsible for most of the symptoms which the elderly men get. So this was just to show a basic anatomy of the urinary system. I shall talk about what our senior citizens should look out for. What are the symptoms which are most common in senior citizens in urology? So we'll start off with basic symptoms, which are, is English good, or should I use any other language?
Oh, this is fine. This is fine. English is fine.
English is good. All right. So maybe I'll use a mixture of English and Hindi, so that if we have audience who would prefer Hindi, they would also gather some points at least.
Well, we have a lot of people from South India as well.
Oh, fantastic.
So perhaps English is a good better.
So I'm married to a Telugu, so I will
you would know better.
Telugu skills too. Well, so frequency is one of the most common symptoms seen in. So at the outset, I'll say that I will start off. Ladies, please excuse me. I will start off with male symptoms first, and then I will go to symptoms which we need to look out for in females, to know what is going wrong and what can be done to sort that out. So in males, frequency of urination is one of the most common symptoms that we see after 55 years of age, more so after 60, but of late we are seeing that even after 55 years of age, a lot of men are presenting with this symptom. So frequency basically means having to go to pass urine very often. So in the daytime, if you have to go to pass urine more frequently than 3 hourly, then that would be considered frequency. We see so many elderly who have to actually end up going to pass urine even hourly. Now, this is of grave concern. Actually, a lot of elderly feel that with age, this is a natural occurrence. This is a natural thing to happen. But we need to be aware that frequency is a marker of an illness. If you're passing urine more frequently, we need to investigate and find out what's causing it. Another very common symptom that we see in elderly men is that of urgency. Urgency, what I would describe urgency as a symptom whereby when one feels like passing urine, one has to rush to the washroom. One has to rush to the washroom to the extent that sometimes one may not be able to control his urination and would leak a few drops or much more than that. Now that is called urge incontinence. So if you're not able to even hold on to your urine, from this moment you feel like passing urine till the moment you actually reach the washroom, it is called urge incontinence. This yet again is a very important marker which everyone should realize that it points to a certain illness. The other symptom which yet again gets neglected is nocturia, which means having to get up more than once or twice in the night from your sleep. A lot of our senior citizen men would wake up 3, 4, 5, sometimes 6 times also and end up going back to sleep immediately. But then what this does is this interrupted sleep would ensure that you're not fresh in the morning, and the whole day goes in a very lazy manner then. So this is a very important symptom which can very well and very easily be corrected if identified, brought to the attention of the concerned medical personnel and treated accordingly. So there could be some these frequency, urgency and nocturia are called irritative voiding symptoms, which are very common in men above 55 to 60 years of age. Some other symptoms which are actually obstructive symptoms could be straining at urination. So if you're not getting a good stream and you're having to actually strain to empty your bladder, that is a very common symptom which is because of obstruction to the passage of urine from the bladder. This needs to be identified and recognized. Another symptom is intermittency, whereby you cannot end up having a continuous flow of urine. You start passing urine and it gets interrupted in between, and then you continue passing urine in multiple installments. Sense of incomplete voiding is yet another symptom, which is a marker of what is going on in the urinary system. So if one, after passing urine, doesn't feel satisfied, if you feel that you're not emptied your bladder, then that is another marker of either the prostate being enlarged and obstruction being there, or a bladder being weak. The flow not being good, flow not being as good as what it used to be when you were 35 years old as compared to when you are 60 years old is yet another marker. Why we are only talking about symptoms at this point is that most of them get neglected. We need to identify them. We need to score the symptoms and know where we stand so that your healthcare provider, the urologist near you, can give you the correct medication to ensure all of this gets sorted. Almost 99% of these symptoms can be managed medically. So there is no need to be experiencing these symptoms. One can just go ahead and meet a urologist and get this investigated with some very basic investigations. And the treatment is as simple as taking a medicine and getting rid of all the symptoms. There are some other symptoms too, which are not as common in men. One of them could be hematuria, which means seeing blood in the urine. Now, blood in the urine can be because of some very sinister causes. Typically, men don't get infections. Usually, if you see blood in urine, 95% of times it would be because of infections, but men are not known to get infections in urine. So the other more common causes could be stones or any cancer anywhere in the urinary system. Now, we can't really afford to miss out on a cancer or any growth in the kidneys, ureter, bladder, prostate, penis, or in the urinary passage by ignoring this symptom. So if any elderly gets any blood in urine, even one instance, it needs to be thoroughly evaluated to rule out any cancer anywhere in the urinary system. Some elderly, typically in India, because it is a diabetes capital for the world, end up having uncontrolled diabetes. And the first infection in uncontrolled diabetes is usually in urine. And elderly, because they're not able to empty their bladder completely, end up getting infections in urine quite often. So if you see change in the color of urine to milky urine, or if it is not amber color or clear color, then there could be pus in the urine, and that needs to be evaluated and sorted. Some elderly can also see some blood in their semen. This also needs to be evaluated, and we got to get to the cause of the hematospermia, and it needs treatment. One of the most neglected and left out symptom is that of getting poor erections. Typically in this country, we feel that after 60, 65, everyone starts to get, the erections keep getting poorer and poorer, which shouldn't be the case. There would definitely be a reason for this to happen. Very typically, it is either uncontrolled diabetes or prolonged abstinence too. Now, we will discuss about erectile dysfunction a little later. Let's finish off the typical urinary symptoms in men first. So as I discussed all the symptoms, I would want to yet again show a sagittal section of the male human body, whereby the lower urinary tract symptoms of the urinary bladder, the passage called the urethra, which starts from the bladder and passes through the penis, comes out. And this is, I'm showing this typically to show the orientation of the prostate. So this gland out here is the prostate gland, through which the urinary passage, which is called urethra, starts from the bladder and then exits through the penis. Now, prostate is a very vital organ in men, not because of its function at this age, but because of its anatomy. Because of where it is situated, the urinary passage starts from within it, and what happens to prostate with advancing age. What happens to prostate with advancing age is that it increases in size. It increases in size not just laterally, but it may just increase in size on the inside where the passage goes through. So if you can appreciate the two diagrams here, this is the passage through a normal prostate, which is open. And if this increases in size, as it has in this, the passage gets compressed and chinked because of the growth of the prostate, which leads to obstruction to the passage of urine. Now, this obstruction to the passage of urine presents as the various symptoms that we talked about. Not everyone will have all the symptoms that exist and that have been discussed just now. So these symptoms can present variably. Every patient can present in a very different way. Some may have one or two or just one symptom, or some patients may have a multitude of symptoms. It could be irritative symptoms of frequency, urgency, or nocturia, or it could be the obstructive symptoms of straining, poor stream, sense of incomplete voiding, and intermittency. We'll get back to the other slide. This is yet again another diagram. I'm trying to make it as simple as possible so people can identify what is going on with them based on the symptoms. And I'm trying to corroborate it with what happens inside the body. So this is a normal bladder and the normal passage of urine through the prostate. And when prostate enlarges, it compresses on this passage and leads to the symptoms that we were discussing earlier. Now, I'm typically talking about prostate because it is responsible for almost 95% of symptoms in elderly men. And it is very easily treatable. Now, this is a chart whereby we can actually know how severe the symptoms are and corroborate it based on this score. So all the symptoms are given scores rate starting from 0 to 5. So incomplete emptying, frequency, intermittency, urgency, weak stream, straining, and nocturia are rated from 0 to 5 based on the severity. And then we calculate a score, which is called the IPSS, the prostatic symptom score, which lets us know a total of this score will let us know if the score is between out of 35, if the score is between 0 to 7, then we know that the patient has mild symptoms and we could observe the patient. If the symptom score is between 8 to 19, we know it is moderately symptomatic and definitely needs attention, and medication can sort almost 99% of these cases. When the symptom score gets to as high as 20 and 35, we need that the patient needs immediate attention, has to be started on medication, has to be kept on a continuous follow-up to see if the symptom score is improving. And say about 10% of patients who wouldn't respond to medication may need some non-invasive or a minimally invasive endoscopic treatment to relieve the obstruction. So when patients, rather than when the elderly population presents with these symptoms, they are given this chart to try and rate their symptoms, to try and score their symptoms. And they themselves can actually identify how significant they are depending on whether they fall in the mild, moderate, and severe category. Next thing to do is to see your urologist if you have any or more of these symptoms. When you see your urologist, what he does is he will take a detailed history, he will check your symptom score, and he will do this examination, which is called the per-rectal examination for men. Now, prostate is an organ which is deeply situated in the pelvis, but it is accessible to be palpated, to be felt through the rectum. So, in a specific position in the urologist's office, with lubrication, the urologist would examine the prostate and feel how big it is, how even the surface is, and whether or not it is tender or it has any nodularity. All of these characters of the prostate, the size, the evenness, nodularity, and whether the overlying rectal mucosa is involved, points us to various illnesses, or whether it is painful or no, would tell us whether there is any evidence of infection in the prostate itself. So this is a very important examination that every urologist does when a patient comes to visit them in the clinic. I will come to the significance of this examination in a bit. Now, prostate cancer is the second most common cancer in men. And with advancing age beyond 60 years of age, the incidence of this and the prevalence of it in the population keeps on increasing. So if I have to, I don't want to be scaring the elderly, but after 70 years of age, almost 10 to 15% of the population can have prostate cancer, because it is a very slow growing illness. And in a lot of patients, it does, if it stays as a low grade disease and doesn't spread anywhere, it doesn't affect lifespan or the quality of life, because it doesn't make any changes in or cause any symptoms. It gets unrecognized. So having to go to a urologist and getting yourself examined gives you a better chance to identify if this illness exists, as it cannot have any symptoms in almost 90% of cases. So cancer in prostate can be recognized in almost 75% of cases by just the per rectal examination. We will talk about very briefly, I will just talk about the treatment for enlarged prostate, and then we come back to the cancer of prostate, which we need to identify and accordingly treat. So the enlarged prostate, as we had talked about, which shows up as the symptoms in men, the typical irritative and obstructive symptoms that we discussed in detail. Almost 85 to 90% of these patients get completely cured of their symptoms with good medications that are available today, which have almost no side effects. So there are quite a few medicines available, which a lot of you may be using also, and various generations of medication and some combination medications also available, which can be used to open up the passage of the urine through the prostate. There is another set of medicines which can be used to shrink the size of prostate. Obviously, the duration of medication for shrinking the size of prostate is a little longer, but the medicines which open up the passage start acting from day one, and the patients see dramatic improvement in their symptoms over the first 2-3 days itself. We obviously need to, on medical management, call the patient back after at least a month to see how much is the improvement in symptoms. Normally, we would expect more than 85 to 90% improvement in symptoms for the medicine to be considered to be acting well. If we don't have that level of improvement in symptoms, then we know that something is amiss and we need to act on it. In that situation, we investigate a little more. So typical investigation when a patient comes with symptoms after the per rectal examination are two. Patients need to undergo one simple ultrasound test, which is done by any radiologist nearby, which lets us know partly the size of the prostate, but more importantly, it lets us know what the prostate is doing to the rest of the urinary system, which is more so important. So whether the bladder is having to overwork to overcome the obstruction of prostate, that will reflect as thickening of the bladder in sonography. Whether the bladder is emptying completely or no, if there is significant obstruction and the bladder has gotten tired of having to overwork, it would start retaining more urine, and there would be more residual volume after one void. So that's what is checked in an ultrasound. One empties the bladder and the sonologist checks to see how much urine is remaining in the bladder. And this gives us crucial information to decide on what medications to overcome this situation. Prostate enlargement leading to residual urine can also start to have back pressure on the kidneys. So swelling in the kidneys can be noticed on ultrasound, which can further present as kidney failure too. So it is imperative and very important to, if you have the symptoms, to get yourself evaluated by the urologist, get the necessary very basic investigation of an ultrasound, and a simple blood test of prostate-specific antigen done, which is optional, but a very good test to know if something's wrong with the prostate. So when 90% of patients get managed with medication and are followed up on medicines, there is a certain subset of patients, typically patients where the prostate is growing inside the bladder, where the medicines don't act as well. So these are the 10% of patients where medicines don't work as well. And these patients, after a trial of medical management, would require endoscopic management to clear out the obstruction. Now, with current technology, it has become almost non-invasive, and the patient can be sent home in after a single day stay in the hospital. This treatment I will discuss with a diagram for you to understand better. So this is a conventional way whereby an endoscope, so a patient comes to the hospital for a day itself. He's taken to the operation theater, and this is for patients where medical management hasn't helped. So yet again, talking about when medical management doesn't help, which means the symptoms haven't resolved or some complication has happened. The typical complications when medicines don't work because of the prostate enlargement could be stones formation in the urinary system, typically in the urinary bladder, because urine is not getting drained completely. Bleeding from the urinary bladder, repeated infections from the urinary bladder, or as I said, back pressure to the kidneys leading to kidney failure or early kidney failure. When any of these happen, or when the patient just stops passing urine, which is called retention of urine, this patient would be a candidate for an endoscopic procedure, and one cannot just continue on medication. How endoscopic procedure is done, I was trying to explain to you, is the patient needs to come to the hospital for just a day or two, depending on what all comorbidities he has. Part anesthesia, so below the waist anesthesia is given, patient is awake, talking to the doctor, talking to the anesthetist, talking to your urologist and the rest of the staff during the procedure. Endoscope with no sensations is introduced through the urinary tract, normal urinary tract, reach the prostate, bladder is evaluated. And then there are various energy forms which can be used. So the typical energy forms used these days are either the holmium laser or the thulium laser to ablate the prostate. Basically what is done is it is enucleated with no blood loss and complete clearance. So there are 2 to 3 different kinds of lasers available. It's either holmium laser or thulium laser, or what had become popular in between but not so commonly used in our country is called green light laser, where it is not enucleated but ablated or vaporized. Now, another way of dealing which is as good is bipolar enucleation, which works well for our country and is much more cost effective too, yielding best possible results too. So most hospitals in the city would have the laser and the bipolar enucleation equipment, which could give the ideal outcome in these patients who don't respond to medical management or have some complications because of the obstruction caused by the prostate. Your doctor will suggest what would work best for you. And I did get a little technical, but all I want you to realize is that this is almost minimally to non-invasive treatment, which results in immediate recovery and perfect outcome. So these new technologies ensure that there is no blood loss during surgeries, and we can get rid of the catheter on the very second day post-surgery, and the patient can start passing urine in a much better manner. Also, the older technology, which led to certain other complications of fluid overload and certain complications because of the heart conditions in patients, and because we had to stop the blood thinners in patients who were having heart conditions or lung conditions. all that gets obviated, and we can continue to give patients their blood thinners and medication and carry out these procedures. So this was, in a nutshell, treatment of enlarged prostate medically and in the cases where it requires intervention by minimally invasive manner. We had briefly talked about this one test called the PSA. PSA stands for prostate specific antigen. Very simple test, not a sensitive, not a very specific test, but a sensitive test. So PSA is a blood test which is letting us know that something is wrong with the prostate. When the levels go up, it could mean, one, it could be a grossly enlarged prostate gland. Two, it could mean some infection in the prostate gland or in urine. Three, it could mean some stones around that area. But most importantly, it tells us that there is a possibility of cancer in the prostate. Now, cancer in the prostate is something that we definitely want to rule out in all elderly men. So in various countries, the screening norms for elderly men may or may not include PSA as an yearly test with or without symptoms. We living in cities have such easy access to blood tests, and it's a simple, inexpensive test. I would go ahead and say that every man beyond 50 years of age should undergo a PSA test. It's a simple, inexpensive blood test, which can be a part of your regular health check, which also I recommend for all men above 50 years of age annually, which can let us know about prostate. Now, if it is high, we definitely need to rule out prostate cancer in men. How is that done? The doctor yet again assesses the prostate by a digital rectal examination, and then one may have to do certain scans to be sure whether the PSA rise is due to cancer or because of the other non-cancerous conditions that I discussed earlier. So these scans could be either the MRI scan or a scan called the PSMA PET scan, which is a specific scan for prostate cancer. And then treatment obviously is decided according to the stage of the disease if it is found. To know if the disease is there or no, the test done is a biopsy if the PSA is significantly high and the ratio of free to total PSA is also pointing towards malignancy. Now, yet again, biopsy is also an outpatient basis test, which is done by urologists or sonologists who are trained to do this. So it is done using ultrasound, yet again through the perrectal way. So a transrectal ultrasound is done and biopsy is taken from prostate from the possible suspicious areas and sent for histopathological examination to know the diagnosis. Why this is important? It's important to know because prostate cancer can spread. It is a slow spreading disease, but it can spread from prostate to just outside the prostate to involving the surrounding organs to the rest of the body. It can spread to the lymph nodes, it can spread to all the bones in the body, and at a very later stage to other solid organs too. And treatment for all stages differs. When we identify it, so why I'm reiterating the need for PSA is that this cancer is totally curable when identified in early stage. So if it is confined to prostate, we can offer them what in today's word is called robotic radical prostatectomy. So with the advancement of having robot, and typically in city like ours, where robots are available in almost all hospitals, this surgery can be done by pinhole method with minimal invasion of the body, getting the best possible outcome, including the best possible functional outcome of preserving continence, which means the control of bladder, and preserving erections too. Now, if this disease, because it doesn't have any symptoms, spreads beyond the prostate, then the treatment changes. The treatment is then control of the disease and not cure of the disease. And for control, there are injections available which block the hormone which makes the prostate cancer grow. So there are injections which could block these hormones. As a result, the cancer regresses. We may not be able to cure this disease by this modality, but we can keep it under control. There are certain newer modalities of treatment whereby even if cancer begins to regrow after controlling with either these hormonal injections or by the process which... So in India, a very popular way of controlling the hormones is removing the functional part of the testis, both the testes. So orchidectomy, bilateral orchidectomy or subcapsular orchidectomy is done whereby the hormones are blocked and the prostate cancer comes under control. But over time, this can get out of the control of these hormonal blockage and can start growing further. And it could require chemotherapy or certain newer tablets which are available, which keep it under check. All this, I'm not stating to scare you, but I'm stating to make you aware of the fact that this disease doesn't have any symptoms, which means identifying it is very difficult. The only way to identify when it is confined to the prostate is if you are going once a year to a urologist for a digital rectal examination. And even if you're not doing that, it's ideal to just do this one blood test of PSA, which will let us know, which will let you know, and you can obviously read from the normal range. If it is higher than the normal range, then it means that there is something wrong. And then you can maybe choose to go to your urologist and your uro-oncologist and get this evaluated. So PSA test and digital rectal examination and identification, early recognition of the symptoms of urinary tract go a long way in ensuring that the urinary health in our elderly men is maintained, preserved, and if anything is wrong, can be corrected with curative intent and not palliative. Coming to the symptom that I said is which gets neglected of erectile dysfunction. Most men think, and their partners also think, that beyond 60 years of age, they're not supposed to or they cannot perform as well sexually. God has sent us on this planet. God has made man, God has made woman, and it has ensured that this is the best pleasure in life. And when done with your partner is the ideal thing which gives most satisfaction. A good orgasm gives more happiness than anything else on this planet. One has to be able to perform well sexually till one is alive. And this is possible. If this is not happening, then as I said, something is amiss. There is something, either it is some medication you're taking that is causing it, either it is some disease like diabetes or some arterial insufficiency, which is causing this, or it is some psychological factor that is causing it. There are various reasons for erectile dysfunction. It needs to be identified, and this can be sorted very well if sought help from your urologist. There are excellent medication with almost no side effects available, which can improve the blood supply to the organ and lead to better erections. So I would urge almost all men who feel that the erection is not as good. So if your erection at 65, 70, even 80 years of age is not 90% of what it used to be when you were 30 years of age, it needs attention. It needs to be sorted, and I guarantee that almost 95% of men will get much more improved erections, which would lead to a much happier life, not just for them as a couple, with their partners. I will not get into the details of the medication. I think this is best to be treated by the urologist. For you, it is important to know that erections are not meant to get weaker with age. not to an extent that you cannot perform as well. They can be sorted very easily. So seek help and it would get sorted. Another very common symptom is that they do get erection, they're able to penetrate, but the erection doesn't last long enough or the ejaculation happens sooner. Very, very common in our country, can be easily sorted out with certain medication or certain exercises too. The idea is to know that these things are not okay, these symptoms are not okay, and they are very much correctable. I think I've given too much time to men. I should give at least a few minutes to female urinary symptoms. Now, females can also very typically present with a lot of urinary symptoms, which are even more neglected than what male urinary symptoms are. Female urinary symptoms very typically are urgency and urge incontinence. Another symptom is stress urinary incontinence, where females cannot hold on to their urine when they exert. So when they cough or they sneeze or they laugh, or sometimes even when they get up from lying down or a sitting position to a standing position, they end up leaking some drops of urine. And most women, this is also seen in some young women, but typically in postmenopausal women after 55 years of age, this is a very common symptom of urinary leakage. So as I said, it could be either urge incontinence, whereby they feel like passing urine, but they end up leaking before going to the washroom, reaching the washroom, or it could be stress urinary incontinence, which happens during coughing, sneezing, etc. The third kind of incontinence is continuous incontinence, which is rare, which is because of some structural defects which can happen in female anatomy. Why these things happen? We know that females are privileged and honored to bear children. Their pelvic anatomy gets distorted when a child is inside the womb, in the uterus. All the ligaments get stretched, the uterus is enlarged, all the ligaments get stretched, and this could happen multiple times if you're having multiple children. After a certain age, see, every ligament gets back to its normalcy, but after a certain age, the support of the uterus, the support of the urinary passage, the angulation of the urethra, all of that changes to some extent. And this could lead to these symptoms. Symptoms of urge incontinence could be because typical irritable bladder in women. Now, you hear it from your mother, you hear it from your mother-in-law that she also leaks a little, but she manages. She may use a small pad, she may use some tissue paper and gets away with it, but it gets ignored and it just, life goes on like that. But why would you want to live like that? This keeps on increasing. If not attended to, these symptoms keep on increasing. Ultimately, what happens, and this unfortunately does happen in good 10% of female patients with these symptoms, that the leakage becomes so pronounced that they stay wet most of the time. This leads to foul odor, which leads to social inhibition. So because you're smelling not so good, you're smelling of urine, you choose to not go in public life. You choose to avoid social gatherings. Definitely not the right thing at that age. So these symptoms ought to be recognized at the right time. They don't need to exist at any age. If any symptom of leakage or urgency or any symptom in female urinary symptom exists, it needs to get evaluated by simple tests of urine culture, by sonography and examination by a urologist, who can then advise excellent medications. So much pharmacotherapy is available now based on patient weight and the kind of symptom patient has, and both kinds of incontinence can be significantly treated. If it cannot be treated fully with medication, then there are some non-invasive or minimally invasive methods like injecting botulinum toxin in the bladder. So Botox, which you would have heard of being used by plastic surgeons to make your face and the body look nice and bright, can be used for treating this incontinence too. If there is stress incontinence, it can be sorted by certain sling procedures, which are daycare procedures. You don't even have to be admitted for the whole day in the hospital. So these slings can pull up the urinary passage of urethra and ensure that the ladies become continent and they don't leak any urine. Important to identify, important to get to the right person and get it sorted in time to prevent complications. I think I will leave some time for questions and answers. And I tried to be as lucid, as basic. I didn't try to go into the science of disease. I just wanted to discuss what symptoms are. They need to be identified so that you know that all of this point to some illness which could be a part of aging, but can be addressed. And the idea is to age gracefully, age but stay young, and to ensure that the quality of life remains the same, even if the years add to the calendar. Thank you for a very patient hearing.
Thank you very much. Thank you very much, Doctor.
I'm happy to take any questions.
Excellent presentation. I'm going to first make a request to you, which I was trying to reach your team. We've had an excellent response to your session today. Even as I speak, there are 95 people who are logged in.
Thank you.
And
I hope it was useful to them, and I hope they identify not just for them. If they have gotten educated, they have a social circle, they have a life, they have their societies. This knowledge is something which needs to get percolated to the community, to the society, to the population, to ensure there is better living for elderly. That is the whole idea for us, using such platforms to get through to you.
Doctor, we announced this thing, and even without having heard you in the past, we had around 300 people who registered. But the kind of response we've received even today was excellent. And I'm going to request you here that we would like you to come once again, because the number of questions is so huge that and I'm sure your responses would only help in doing that. So I will be in touch with your office and request you for that. But I'm going to go through the questions little by as quickly as possible and try and avoid. There are some specific things. Ashok Grover says, ask how good is Silodal D8 for enlarged prostate? Is it required to be taken for life?
So Silodal D8, I mean, we should not get into specific medication, but I will just briefly state that Silodal D is a combination of two medicines. Silodal is a medicine which is primarily silodosin, which opens up the passage, and D component is a blocker of hormone, which helps in shrinking the size of prostate if taken for longer than 8-9 months. So it needs to be used based on the symptoms, based on the ultrasound findings. And I'm sure you would have gone to a urologist to get this prescribed, and he would have gone through your symptoms. I will say, yes, it is a good medicine, but the D component one has to be very careful in using, because it can have certain side effects. And hopefully your urologist or the physician who's prescribed this has discussed those side effects, because blocking the hormone will lead to shrinking of gland, but blocking the hormone would also lead to certain other symptoms, typically enlarged painful breasts sometimes. And the testosterone hormone that it blocks also leads to loss of libido, sometimes muscle wasting, sometimes some bone weakness. So I would use it with caution. You may go to your urologist or your physician and discuss the dutasteride component in detail, and then consider taking this medicine. For life, it depends on how much the symptom relief is, how well the prostate shrunk on that medication. And obviously, regular follow-up is needed to decide what dosage you're taking. An 8 milligram dosage, it may require to be reduced to 4 milligrams. You may not need the dutasteride component, So all that happens with regular follow-up, and the doctor can advise you on that.
My advice to everyone is, while the advice that we're giving you over here is there, but please do consult your urologist or the nearest hospital, and you can get the best medical advice. We have a few questions which I wouldn't like to take the name of the person, but the person says, I'm 70 years old, I'm on high blood pressure, mild diabetes, and neuropathy medicines. I'm suffering from EDF. Is there anything that one can suggest to him? And there's another question.
So there are very good medications available, which in spite of you having blood pressure and heart issues, can be taken for improving this condition. So yet again, my recommendation, if you are in Bombay, I'm happy to treat you. You can come to Nanavati Hospital, or else any urologist close to you should be able to evaluate you very well and advise you the medication. It might not be right to prescribe or give medical advice on this forum, but yes, this condition is very well treatable and easily too.
Doctor, there's a question which has come in, and it says that, Doctor, I feel very shy to discuss about EDF with anyone. Can one do it anonymously, or should I just forget about the shyness and approach a doctor?
I think one should forget about the shyness. This is, you are depriving yourself of the best pleasure in life. Don't do that. Your doctor is meant to treat that. Your urologist, your endourologist is meant to treat that. See to it that you go to a urologist and discuss it in detail, and he should be able to help you greatly. Actually, he should be able to sort this thing. There is no reason to not have good erections or not have a pleasurable intercourse.
Doctor, we have a question from an anonymous attendee who says, my father, who's 75, has gone through a prostate surgery about 6 years back, and it's experienced some of the symptoms again now. Would you suggest medication as the best course of treatment, or would it qualify for surgery again?
So this is very individual actually. So basically, get a sonography done. One needs to know if the prostate has regrown. Ideally, when we do surgery, at least for next 30-40 years, it should stay clear. But sometimes the passage beyond the prostate can narrow, and that can lead to such symptoms. So an ultrasound should help, and see your urologist or any urologist close to you. You can come see me, and then we can decide how best. Obviously, we would try to sort it out with medication, because it's been only 6 years, and we see, even if you haven't had surgery, we try as far as possible to manage patients with medication. Only if the patient tells us, no, this is not working, is surgery required. But identifying the cause is most important. You need to know what, if you are treating a stricture in the urethra, which is narrowing of the passage, with medication, it is not going to help at all. So we need to know whether it is the prostate which is blocking, or there is a weak bladder which is leading to the symptoms, or a stricture in the urethra. So let the expert decide on that.
Absolutely. Doctor, we have a question from Dr. Sham Mahajan, who says, it is said that drinking beer helps to have good urine flow. Is it better, or at least as good as water? How much water should one drink every day for better health?
So talk about how much water to drink. Actually, the body decides. One doesn't need to specifically decide that, okay, I'm going to drink 1.5 liters or 3 liters. So body decides how much. So the thirst center in the brain decides how much water one needs. So it varies depending on what your level of physical activity is, how much exercise you do, how much you perspire, how much you sweat in a day, how hot is the day, how humid is the day. But talking about Mumbai weather, talking about medium to moderate active physical activity, I would say that one doesn't need more than 2 liters of water, including all the other liquids that you're taking. So a lot of men, they hear paramedics, or I would say they hear alternative medicine people who state that drink as much water as possible. So if you drink 3, 4, 5 liters of water, you're actually straining your kidneys. They are making them overwork. Specifically in elderly, if you consume too much water, you end up washing up your sodium from the body, which can lead to complications. So let the body decide how much water it needs. If you feel thirsty, you should drink. But obviously, if you're diabetic and not controlled, you will keep feeling thirsty. So correct that diabetes and don't base it on that. And yeah, I mean, for an average 60, 70, 80-year-old, up to 1.5 to 2 liters of water is good enough. If your symptoms are bothersome, you can even limit it to 1.5 liters if your activity level is not too high.
Doctor, we have some 20 odd questions to ask, but which have been asked. But I'm going to stop at this because we are already at 6 o'clock. And as I mentioned, we will record all the questions that you've sent. There have been a few things that have been asked. One is this session, a recording of this session will be there on seniorstoday.in on Monday evening or sometime around the day with the edited, with the takeaways of this session, which will be written by a medically qualified doctor who will do it. So these will be up on Monday afternoon, and you can look at them. As far as reaching Dr. Arora is concerned, you could reach him at Nanavati Max Hospitals, which is there in Villaparle in Mumbai, and those numbers are there on the website. But we will put them again on our takeaways on Monday, so you can reach doctor at that time. And that apart, thank you, doctor, very much for being here. Those of you
absolutely my pleasure to be a part of this forum, and hopefully some knowledge gets percolated, as I said, and I would be happy to be a part of this forum and attend to other issues concerning the urology. I thought this time I should just touch the very basics, and then we can go into other aspects too.
Doctor, I must tell you that the response that we have received today to this session has just shown that we should be doing more of these sessions, especially on urology, because the kind of response we've received has been tremendous. Just a few house announcements. We are, as I mentioned, we have completed 3 years of Seniors Today, and the 3rd anniversary issue of Seniors Today is going to be out on 15th of July. And this will be there on our website, seniorstoday.in. As always, this is available free of cost, as more than 1.6 lakh people have realized it and have subscribed to it. So do take benefit of Seniors Today and all the fantastic content that we have, even though I say it myself. And as I mentioned, we've had a fantastic session today with Dr. Avanish Arora, and we will record these questions, and we will be in touch with his office to figure how we can get responses to these if he's not able to come in, in the next few weeks or month. But we will not let your questions go unaddressed. Thank you very much, Dr. Arora, once again. And
thank you, Pradyuman. The society needs more Pradyumans to ensure that healthy living is a way of life.
Well, it's all thanks to the forum that we have, Seniors Today, and everybody who's been here, who's ensured that we build this. And of course, I must confess that I'm so thankful to doctors like yourself who have been here, through the last 2 years, and who have been partnering this, and hospitals like the Nanavati Max Hospital, who has also been, I do understand it's a Saturday evening. It's I know you have a long way to commute in the Mumbai rains, but it is so good that you all are here and helping us out and helping senior citizens. Thank you very much.
My pleasure. Happy to be here. Thank you. Thank you.
Subscribe now and press the bell icon. Never miss an update.